Melissa. My event is clinical specialty, and for my skill, I chose to inject neurotoxins into the forehead area. Neurotoxins are great because they help prevent fine lines and wrinkles. Neurotoxins work great for this because they block the nerve signals that cause facial contractions. To get started, I'm going to introduce myself to the patient and discuss procedures with them. After we have determined which procedure we are going to do, I'm going to discuss possible outcomes and aftercare with the patient. Hi, my name is Pazlee. What can I do for you today?
Hi, I was wondering how you can help me get rid of the fine lines on my forehead.
I would recommend using a neurotoxin to temporarily paralyze the muscles in your forehead. The effects usually last for around 2 to 3 months. It really varies depending on the patient though.
Also, I was wondering when I will see the effects of the Botox.
You usually see the effects 7 to 14 days after injections.
Awesome, that would be great.
Have I answered all of your questions?
Yes, ma'am.
You ready to get started?
Yes, ma'am.
Okay. Now that we have discussed and determined the proper procedure, I'm going to have the patient sign consent forms.
You're welcome.
So now I'm going to wash my hands to get rid of any bacteria. So now that I've washed my hands, I'm going to be putting on gloves. Now I'm going to have the patient animate their face so I can mark injection sites. Raise your eyebrows for me, please. So her full line is right here, which basically means that it is the most prominent line in her face. That's where the muscle runs across. So I'm going to inject here, 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 and here. And all face doesn't just stay in one spot. I'm going to inject here and here, so the movement isn't awkward when she moves her face. I'm going to prepare the patient for the injections by asking her if she's ready. You ready to start?
Yes, ma'am.
First, I'm going to begin by wiping the vial in the patient's face with alcohol pads. Now I'm going to begin doing the injections. I'm injecting into the frontalis muscle, which is the muscle that runs just above your eyebrows to about the middle of your head. This muscle controls the upward motion of your eyebrows. I'm placing 1 unit into each injection site. I'm being cautious not to go too deep with each injection and also to wipe the site after each injection with an alcohol pad. I have completed the procedure. I'm going to place a syringe in the biohazard bin. So now I'm going to take my gloves off and wash my hands. So now I'm going to re-explain any downtime and aftercare for the procedure. Remember to not exercise or lay down or do anything else that might cause pressure to your face for at least 6 hours after injections. Also, do not drink excessive caffeine or alcohol or take any aspirin that might thin your blood. You should wait at least 2 weeks before having any other facial procedures done. Do you have any more questions?
No, ma'am, thank you.
No problem. Now that the patient has left, I'm going to wipe down and sanitize everything in the room. The last step is to ensure that all documents are in order and start the procedure.